I specialize in bariatric surgery, and I also specialize in minimally invasive surgery, which means that we're doing surgery through small incisions. I think the main driver of weight loss surgery, and certainly one of the reasons insurance will pay for these surgeries, is because of the health benefits. And if you have bariatric surgery, there's a good chance that you will have resolution of those medical problems, or at the very least, the medications you use will be lessened to a considerable degree. The vast majority of our patients, about 95%, have surgery through small incisions, either robotically or less so now laparoscopically, and our average length of stay is barely above a day. I think the philosophy I like to take is kind of one I was taught a long time ago, and it's actually a quote from Vince Lombardi, and it's a football quote, but it goes something like this. You strive for perfection, and you'll know you'll never reach it, but in trying to strive for perfection, you'll reach excellence. Trying to always improve on what we do, we are trying to build on that excellence. We have strict follow-up after surgery. Usually they come back the first 1 or 2 weeks after surgery for the initial visit, and we follow them at 6 weeks, 3 months, and in the first year multiple times. We will always see you once a year for the remainder, as long as you come back just for follow-up. One of the requirements for almost all insurances is a psychological evaluation, and some people have completely realistic expectations about surgery and why they want to have surgery, but there may be some people who have unrealistic expectations, and everyone gets a psychological evaluation, and they have to be both medically ready and psychologically competent enough to understand the surgery, and if they fulfill both criteria, they'll be okay for surgery. In terms of what they can do, people can shower day 2, and in terms of light exercising, like an exercise bike or treadmill exercises, we recommend doing that even the first week after surgery. You're just limited in terms of lifting, and depending on your job, your recovery will and your return to work will be determined by what you do. The thing with bariatric patients is when I see them, they've lost like 50 to 100 pounds. I have no idea who they are. You know, the regular patients, I have an idea, because they look the same, and I guess it's a good thing. And they seem awfully happy to see me, and it's quite comforting to know that they've done well. But I think that for that one moment, I'm always like, I wish I knew who they were.